Raywat Deonandan is part of a workplace where vaccines are mandatory. He's at the University of Ottawa and a frequent contributor here on 680 CJOB. Epidemiologist Raywat Deonandan, good afternoon, and thank you for joining us.
Good afternoon.
As we're starting to see this wave across the country, first of all, let's talk about the good news wave. That's more and more people getting vaccinated, more workplaces saying to their employees, yeah, you should get vaccinated. We're going to make it mandatory.
It's a good move. The question is it going to be enough? It's an incentive that will nudge the hesitant towards accepting vaccination, but will it happen fast enough to help bludgeon this coming tsunami of cases?
Take us through Canada here and what we are seeing now and expecting in this fourth wave. Talk a little bit about demographics here, how the third wave is, or the fourth wave is different from the other waves, et cetera. Take us on a little bit of an exploratory route here, if you could.
Well, the story hasn't changed in some ways. It's still a tale of 6 provinces of Alberta, BC, Saskatchewan, Quebec, Ontario. The maritime provinces are still, or Atlantic Canadian provinces rather, are still doing relatively well, and the territories are doing relatively well. But the difference now is in how they've responded with the new tool of vaccination. So BC recently announced it's bringing in a vaccine passport system, so is Quebec. Ontario might follow suit at some point, it's unclear, but the way the demographics have changed are really interesting. So because we have hardened that population most likely to die, and that, by which I mean the elderly, the death rates have come down significantly. However, Delta has changed the slate somewhat. It's more aggressive and more likely to just tear through an unvaccinated population. So the fact that we have many young adults and teenagers who are unvaccinated is showing up in the case counts. They're the ones who are now represented both in the infections and in the hospitalizations. It's quite worrying. We're not quite seeing yet in Canada the rise in pediatric ICU admissions at the same rate as we see in some American states, but I'm afraid to say that is what I'm anticipating to see if we cannot harden our school system and wrap around our children with the appropriate public health measures.
Ray, as more people are getting vaccinated and you know, we're hearing Doctors Manitoba asking for that vaccine mandate for healthcare workers, also pleading with other industries. The feds say if you're getting on a plane, a train, or a boat, you have to be vaccinated, and a lot of federally regulated workers are going to have to do the same. So there is a lot of people out there that are vaccinated. So now we're shifting our thoughts to these breakthrough cases. And in Saskatchewan, for example, it's now reporting its cases of the number of people who got COVID who are unvaccinated, partially vaccinated, and fully vaccinated. So we're a little bit more aware now about the level of infection that's breaking through to those who are fully vaccinated. And it's got some people worked up, and I'm seeing that on social media saying, why are there more people getting it even though they're double vaccinated, say more so than even partially vaccinated people? And you have a take on this.
Yeah, first of all, what we call it is important. So calling it breakthrough infections suggests that there's a wall and the wall is failing. It should be called spillover infections because the wall is standing. It's just there's so many virus circulating that they're spilling over that wall. But what you describe is an example of what we call the base rate fallacy. It essentially says this: as more people become vaccinated, then that tiny proportion who experience the spillover infections becomes a larger number because simply the denominator is larger. So imagine if we live in a society where everyone wears seatbelts, 100% wears seatbelts. The fatality rate amongst car crashes comes down significantly. It doesn't go to zero, though, but it comes down a lot. But amongst those car crash fatalities that do happen, 100% wore seatbelts. It doesn't mean the seatbelts are failing. It just means that everybody wears seatbelts. Eventually, when 100% of people are vaccinated, the number of cases will be small, but those few cases, 100% of them will be vaccinated. That is the fallacy we're looking at. So I don't like to look at the proportion of infections that are vaccinated versus unvaccinated. I'd rather look at the proportion of vaccinated that are infected and the proportion of unvaccinated who are infected. That tells us the true story of risk. That's what we care about here, risk. And the risk of being vaccinated is dwindlingly small, vanishingly small compared to the risk of being unvaccinated.
And we know that the vaccine isn't a cure, and that I think it's important to remind people the vaccine does not stop you from getting COVID-19. So these spillover cases, as you call them, are going to happen. But do we have the data backing up that those are milder infections with fewer admissions and deaths?
It does look that way. So most vaccines don't prevent infection. We call that sterilizing immunity, and that's actually pretty rare. And it was always going to be a bit of a Hail Mary to hope for sterilizing immunity here. But what we hope for, and that's what we're seeing, is the vaccines, for the most part, prevent hospitalization, and to an extremely high degree, they prevent death. And the data still bears that out, even as we're seeing in places like Israel and the USA, where maybe there's some diminishing immunity as time goes by. The effectiveness against hospitalization and death remains quite high. And that's what we should care about. These vaccines keep us out of the hospital, and they keep us out of the morgue.
With University of Ottawa epidemiologist Raywat Deonandan, Richard and Julie with you on 680 CJOB. As we prepare for back to school, what's your message to parents who want their children back in school full time? We've got the Manitoba Teachers Society here wanting teachers and everybody that comes into that school fully vaccinated that can at this point. We know those kids under the age 12 can't get vaccinated yet. What's your message to parents?
My message is, if your kid is over 12, get him or her vaccinated. Second of all, as the teachers' unions and employers try to get mandatory vaccination for everyone in that school, the other half of the equation is getting the parents of all the kids vaccinated, because those are the adults that also expose themselves to all the children. So as much as we can wrap protection around those kids, we should seek to do, though, to the highest extent possible. That means every adult that those kids come into contact with should be vaccinated and should limit their exposures, even if they've been vaccinated. So you don't have to go to that party. And if you're going to go indoors places, make sure that you're wearing masks. High-quality masks, N95s if you can afford them. COVID is airborne. That is the takeaway message of the last few months of scientific consensus. That means distancing is not as powerful a tool as we had hoped. What matters is ventilation and good quality mask wearing and vaccination. With those tools, we can get through this.
And the reality, though, Raywat Deonandan, is that there are going to be some kids under the age of 12 that end up in the hospital, that end up in the ICU.
Yeah, as we're seeing in the U.S., about 1% of infections end up in the hospital, and a third of those might end up in the ICU. And those are tiny numbers, really. However, a tiny proportion of a large number is a large number, and you don't want to be the parent of that one kid who ends up in the ICU and who dies, right? So we got to do everything we can to prevent this. And I can't stress this enough. Vaccination is our easiest, most effective tool right now for individual citizens to seek, while we lobby our governments to make sure that the schools themselves are safe via ventilation and masking policies and symptom checks. Also, if your kid is symptomatic, keep him or her out of school. He or she may not have COVID, but if they do, they're less likely to spread it if they're asymptomatic. So if they're symptomatic, keep them out of the general population.
30 seconds are now yours. Ray, what's on your mind? What do you want to tell our listeners? Because I see your tweets, not everyone can see them, and I know you have some thoughts on what's going on, what's concerning you, what you like. Positive or negative? Fire away.
Yeah, this is not interminable. We will see an end to this. Whether sooner or later, I don't know, but we have it in our power to put an end to this. And as citizens, the simplest thing we can do is get vaccinated and cajole and encourage our friends to get vaccinated. And the other simple thing, or less simple thing, is lobby our government and our employers to recommend mask wearing indoors and vaccination for everybody. If we do these things, we can bludgeon this wave quite quickly and effectively.
Raywat Deonandan, always a pleasure, and always appreciate your time and insight. Thanks for joining us this afternoon.
Thank you.